Hi guys, welcome to our final video in our series about the lameness workups that we can do here at Brooke and what every single stage means and why do we do them. So today, as we mentioned on the last video, we're going to be talking about the most interactive part of the lameness investigation, including nerve blocks, flexion tests, back manipulation, back palpation, x-rays, ultrasound scans, all that part of the lameness investigation. We hope you enjoy it. So the first step we're going to mention today are the flexion tests, and this is something that you're going to see being done very often. Basically, the idea behind it, there's many ways to go about it, but the idea behind it is to overflex a joint or a group of joints, causing a similar effect that we usually feel when we squat for too long, and then we stand up and we feel some pain in our knees. We are basically doing the same thing with the horse for 45 to 60 seconds, and then we immediately ask the horse to trot up, and we see if the horse is more lame than he was before the flexion test, always making sure to disregard the first few steps, because even a sound horse might be a little bit stiff after the flexion test to begin with. So another stage of the lameness investigation will include back, neck, and sacroiliac joint palpation and manipulation. So basically all these areas that we cannot actually do flexion tests, for example, what we can do is just apply pressure or force the horse to stretch and bend a certain way to try and elicit a pain response with all these exercises. These are particularly useful when we are dealing with, for example, kissing spines or neck stiffness or sacroiliac joint pain. We can also do it, for example, for the shoulder joint, which again we cannot properly flex, but we can manipulate and force the horse to stretch forward, stretch backwards, and abduct the limb, which means pulling the limb to the outside, and see if any of these causes basically pain to the horse, and this will be an extra clue to try and determine where the pain is coming from. Another step that we may include in our lameness investigation, although not always, will be to actually see the horse under saddle. So we will ask the horse to do some breathing exercise. That is especially important in horses in which we suspect either some back or hind limb pathology, or in horses that not having a lameness per se have what we usually call a poor performance under saddle. In those cases, this step might be actually invaluable, although it might in other cases be more difficult to interpret the gait itself, just because the rider will always have to some extent an impact on the way the horse moves, so we need to be cautious in the way we evaluate the gait of the horse under saddle. Okay, so now that we've already established our baseline of lameness, we can start doing some nerve blocks and hopefully try to see a difference between before and after the nerve block. So basically there will be two types of what we call regional anesthesia that can be performed. We can either inject the anesthetic around a nerve, which that will be a proper nerve block, or we can inject it in a synovial space, being that joint or a sheath or bursa, for example. In any case, basically what we're doing is we inject local anesthetic, we wait a couple of minutes for it to take effect, and then we will trot up the horse again afterwards. If the horse stops being lame or shows a significant improvement, then we will know that we've discovered the general area of pain. So once we've established the general area of pain, and based on our clinical suspicions, we will most likely advance to some sort of diagnostic imaging, such as ultrasound scans or x-rays. As a rule of thumb, usually ultrasound scans will be more appropriate when suspecting a soft tissue pathology, like for example a tear within a ligament or a tendon, while x-rays will usually be more indicated when suspecting a pathology involving bone or a joint, such as for example osteoarthritis, a fracture, or a cyst-like lesion. Okay, so that terminates our series of videos talking about the stages of the lameness investigation here at Brooke. So if you have any concerns regarding the lameness of your horse, no matter how big or small, just give us a call. Thank you, and I'll see you in the next videos.